I hope you have a clear understanding of the anatomy now. So let's revisit the valves. There are four important valves. The first valve is the tricuspid valve. The tricuspid valve is right over here, the valve in between the right atrium and the right ventricle is called the tricuspid valve because it has three flaps. When the ventricles contract, it prevents backflow from the right ventricle into the right atrium. And on the right side, the other valve is the pulmonary valve. The pulmonary valve is right over here. The pulmonary valve is also called a pulmonary semilunar valve because it's the shape of a crescent. Okay, and the pulmonary valve prevents blood from moving from the pulmonary trunk back into the ventricle when the heart is when the heart is relaxed. Sorry. So valves prevent backflow in the opposite direction. Just keep that in mind. Now, the next valve is on the left. The valve between the left atrium and the left ventricle is known as the mitral valve. The mitral valve is also known as the bicuspid valve because it has two flaps. It prevents backflow from left ventricle into the left atrium. And the last valve on the left side is the aortic valve. The aortic valve is at the entrance of the aorta from the left ventricle. When the heart is relaxed, this valve prevents backflow of blood from the aorta back into the left ventricle. All valves prevent backflow. The aortic valve is also a semilunar valve. So we have two semilunar valves, aortic valve and pulmonary valve. You're looking at the transverse section of the heart in a way that you can see the valves of the heart. So this over here is the pulmonary trunk, the aorta, the right side of the heart, and this is the left side of the heart. Okay? So this over here is the pulmonary semilunar valve. This is the aortic semilunar valve. The valve on the left side is known as the mitral valve. Another term for mitral valve is bicuspid valve. This valve is also known as the left AV valve. It's called the AV valve because it is a valve in between the atrium and ventricles. So left atrioventricular valve. So on the right you have the right atrioventricular valve, which we call the tricuspid valve. It has three flaps. That's why we call it the tricuspid valve. You see a beautiful image of the aortic valve. This is the superior view. So he's looking at it from the top. And valves are very important to prevent backflow. Now, even if the valves leak blood to a certain degree, the heart can actually continue to function. And normally the most common faulty valve is the mitral valve. The mitral valve. Oh, let's see. Mitral valve. So this is a condition wherein the mitral valve doesn't shut close properly and it causes backflow or regurgitation. Now, a lot of people who have MVP don't even know it and they can function properly. But as they age, the heart needs to work harder and they can have issues when they get older. But you can identify mitral valve prolapse or backflow when you listen to the sounds of the heart. Now, the condition where the heart valve is, it causes the heart valve to pump the same blood over and over due to regurgitation. This is described as incompetent. Okay, so an insufficient heart valve is called an incompetent heart valve because it ends up circulating the same blood over and over because of backflow. And the term carditis. Itis means inflammation. Carditis is any inflammation of the heart. And a lot of times carditis can be linked to a condition known as rheumatic fever. Rheumatic fever. So rheumatic fever is a disease that can result when strep throat or scarlet fever is not properly treated. And that leaves the heart valves permanently damaged, and it can affect the connective tissues of the heart. And the common bacteria that causes this condition is Streptococcus bacteria that causes strep throat. So when that happens, it can leave scar tissue, and eventually, because of the scar tissue, it can cause calcium deposits and the valves remain stiffened. Okay, so stiffened valve itself is called stenosis. Stenosis basically means stiffening. Okay, so valvular stenosis means a generic term for stiffening of the heart valve. Okay, and this causes the valves to not shut close properly, which increases the workload on the heart. So over time, a faulty valve can cause a lot of mechanical issues with the heart itself, and it can start affecting other regions of the heart because the heart works extra hard to pump blood. Now we have a method to replace a faulty heart valves with a pig or a cow valve. Okay, so these valves are chemically treated to prevent rejection and cryopreserved. Cryopreserved valve. Cryopreserved valve. So if a person has a correct match, even human cadaver valves can be transplanted after they are specially frozen. So if somebody has a faulty valve, it can totally be replaced now. But again, a faulty heart valve can make the heart work extra hard. This picture over here is that of a bicuspid valve. You see the papillary muscles and you see the chordae tendineae holding the tricuspid valve, and they help in making sure the tricuspid valve shuts closed properly when the ventricles contract.